In my future, I want to encourage people, because people see other people who look just like them doing certain professions and they think, well, I can do that too. Being home with my kids, I had some time to read through magazines, and I would flip through a lot of them, and when I came across an ad from Johnson & Johnson, Become a Nurse, a campaign for nursing's future, there was a particular woman in the ad who looked just like me. And it reminded me that I wanted to be a nurse a long time ago.
She had a presence. I detected a presence. She was someone that was easy to speak to, and she just gave a very warm persona.
I applied to nursing school. I was accepted, and I just kept going.
She was just highly motivated, wanted to learn as much as she possibly could.
Going through nursing school retrains your brain to think differently. You assess not only your patients, but your life. And nursing has given me a sense of stability in my life. Being an at-home mom with just one income, you wondered how you were going to make ends meet, but I don't have to worry about that anymore. I have a great career where I can climb the ladder or not climb the ladder and still do very well, and still take care of my patients, and still take care of my family.
Exceptional with patients and their families, a great bedside manner, the type of nurse that I would like to take care of me if I were ill.
I advocate for my patients both ways. I advocate for my patients to their family members so that the family members know when they get home that they need to be on this regimen for X, Y, and Z reason. And I advocate for my patients to the doctors. We have to make sure that the doctors understand what the patient is going through right at this moment, and they need to respond right now.
She's a great asset on the floor because she's always positive and she's caring with the patients, and she's full of energy.
I think every day I'm on the floor with my patients, I realize they look to me for answers.
She is very connected to her patients, and she will have conversations with them, and she will speak to them and speak to families.
They appreciate what you're doing, and that makes me realize, oh, I'm doing a good job. I'm really a great nurse. Just this past weekend, I had a patient. We shared some jokes. We talked about TV shows, different magazine articles. It was just very nice to interact with her while I'm giving care. And that's one of the things I like to do, because you can distract from why I'm doing something to her, like why I'm giving her medicine, by talking about lighthearted stuff.
You're concerned about their well-being and the well-being of their family and how the entire family unit is going through the process. So you really work hard to make their outcomes positive.
She's going to go home, be with her family because of you. You've made her better.
It's the reason why we all came into nursing, is to help patients, or help people, and to care for people. And in return, we get that satisfaction when we know we've done that.
And that's encouraging. That's why you go into nursing, to make people better.
With many people on many different levels, I think that she's a great spokesperson for nursing today.
One of the ways that I hope to combat the nursing shortage now and in the future is to encourage our youth to consider the nursing profession. So I just try to talk about the different advantages that you have with the nursing career. And you don't have to be a female. You can be a male going into the nursing career, and you would be set for life.
Even though Kiva's a young nurse, I think that she is a great role model because she lives nursing. And I think she lives nursing not only here in the hospital, but I think she lives nursing in her community. I think she is somebody who people look up to.
I have a lot of neighbors, children who are in high school now. One neighbor in particular, she is going to nursing school in the fall. It's wonderful. I think back on the Johnson & Johnson ad. I think back on the nurses who helped me through labor and delivery. I think back on the nurses who take care of my family when they're in the hospital. They were very encouraging to me.
I have great expectations for her. I think that she will actually do great things in nursing and really contribute to the profession.
I'm part of nursing's future, and I want to be just like those who have come before me, and I want to be encouraging to those who come after me to aspire to be whatever they want to be, but the nursing career is fabulous.
There are some who dare